And in the chat. So, Diana, go Grizz, you are totally right. All right, so I'm going to start off with introducing myself. You guys just got a little bit of a background on me. So I'm Erica Baldry. As stated, I attended both undergraduate and graduate school in Missoula, Montana at the University of Montana. And I was actually born and raised in Eastern Montana. So I'm a Montana girl through and through, and I am so blessed that I get to serve Montana residents every single day in my job. I've been working in public health as an epidemiologist for over 6 years. Epidemiology is the study of disease. And so a lot of times I'll get asked, is that the study of skin? And no, we actually study disease and disease transmission, and get to do a lot of data analysis related to disease. I became board certified in infection prevention and control in 2019, and I currently I served as the program manager and epidemiologist for the Healthcare Associated Infections Program for 4 years. So, right out of school, I was able to enter this position. And then in 2021, as many of you know or probably experienced through the COVID-19 pandemic, there was a huge need for infection control and prevention and knowledge related to healthcare associated infections. And so in Montana, the Infection Control and Prevention and Healthcare Associated Infection section was created. And it really was created to help support healthcare facilities and healthcare personnel throughout the state. I am the current section supervisor, and as you can imagine, I absolutely love talking about infection prevention, especially hand hygiene. My staff always say that's my favorite thing to talk about, and I think they're right. And I'm so excited to be presenting to you all today. So thank you for the invitation. I have a couple of objectives for today's presentation. The first is to discuss the role of standard precautions in infection prevention. And the second is to identify infection prevention and control practices that can lead to safer care and improve patient safety. There are several core practices included in CDC's core infection prevention and control practices. These include leadership support, education and training of healthcare personnel on infection prevention, patient, family, and caregiver education, performance monitoring and feedback, standard precautions, transmission-based precautions, temporary invasive medical devices for clinical management, and occupational health. Today, we're going to be focusing on the fifth core practice, which is standard precautions. Standard precautions are the first tier of basic infection control practices that apply to all patient interactions in all healthcare settings, regardless of a patient's suspected or confirmed infectious status. These practices protect healthcare personnel and prevent healthcare personnel or the environment from transmitting infectious agents to patients, and are based on the general principle that all blood, body fluids, secretions, non-intact skin, mucous membranes, and excretions may contain transmissible infectious agents. However, please note that this may vary from pathogen to pathogen. And one thing that I always like to point out when I'm working with healthcare facilities or healthcare personnel here in Montana is, you can't always tell if someone has something communicable or not. And so we always want to implement standard precautions so we're protecting ourselves, we're protecting our patients, and we're protecting our peers. Standard precautions include the following topics: hand hygiene, environmental cleaning and disinfection, injection and medication safety, risk assessment with the appropriate use of personal protective equipment, minimizing potential exposures, and reprocessing of reusable medical equipment between each patient or when soiled. And these are the topics that we're going to be reviewing in today's presentation. I usually like to kick my presentations off with discussing the chain of infection. And, when we think of infection spreading from person to person, I don't know if we always think about all the steps that have to take place for that infection to actually spread, right? There are a specific set of conditions that must exist in a specific sequence for that infection to spread, right? And in the next slide, we're going to talk about how we break this chain of infection and things that we can do. So the first step is the microorganism or the agent, and this can be a bacteria, a virus, a fungus, or a parasite. So for example, it could be influenza virus. The next is reservoir or source, And this is the place where the agent lives, grows, and multiplies, right? So this is that habitat that allows the or the microorganism to grow. The next step is the portal of exit. And this is actually how that pathogen of concern leaves the source, right? So this may be through secretions such as saliva or excretions like urine and feces, right? So these things that we want to protect ourselves against and why we use standard precautions. The next is the method of transport or method of transmission. And so this is where, transmission-based precautions may sound familiar. Modes of transmission include contact, droplet, and airborne, or vector and fomite. So sometimes you'll hear something is vector-borne or waterborne. And this is how this microorganism or pathogen or germ of concern actually is able to be transmitted to others. And so some of those words may sound familiar because they match the transmission-based precautions that we use. The next is portal of entry. And so this is actually how that pathogen enters the body of a potential host. So this could be through the mucosa lining, open wound, oral, respiratory tract, urinary tract. And so a lot of times when we're talking about infection control and protection, we're saying, cover those mucous membranes, right? Your eyes, nose, and mouth. And this is why, because those are common ports of entry. And then finally, susceptible host. So typically, these are going to be individuals that we would consider at risk, right? The very young or elderly, immunocompromised individuals, maybe those with chronic diseases. And so all of these steps have to happen for infection to spread. And so as you can see, there's a lot of opportunity for us to break that chain of infection and to protect ourselves and others. The first way through the infectious agent is diagnosis and treatment or antimicrobial stewardship, right? And so if we know what that infectious agent is, we're able to diagnose it and maybe get antivirals to somebody or the right antibiotic, right? If we don't test or if we don't know what the pathogen of concern is, it's really hard for us to know what steps to take. Reservoir, we can do things like cleaning and disinfection, sterilization, infection prevention policies, or pest control, right? So if we're talking about something that's vector-borne, it's spread through a vector, we would want pest control. For cleaning and disinfection, we want to make sure that we're using products that are approved for the organism of concern. And we'll talk a little bit more about that later on in this presentation. Portal of exit, we can do things like hand hygiene, my personal favorite, personal protective equipment, control of aerosols and splatters, respiratory etiquette, waste disposal, right? So really controlling that infected individual from spreading it to others. Mode of transmission, once again, hand hygiene, personal protective equipment, food safety. As many of you know, there are foodborne illnesses that are spread through contaminated food. Cleaning, disinfection, sterilization, isolation. There's a reason that CDC often recommends isolating infected individuals so we're not spreading to others. Portal of entry, such as hand hygiene, personal protective equipment, personal hygiene, first aid, removal of catheters and tubes. With our multi-drug resistant organisms, we know that individuals that have wounds or indwelling medical devices such as catheters are at an increased risk of acquiring our multi-drug resistant organisms. And so a lot of guidance really talks and focuses on removing those indwelling medical devices as soon as possible, when possible. And then finally, a susceptible host. We can prevent or break the chain of infection by staying up to date on our immunizations, treating underlying disease that could put individuals at a higher risk of acquiring diseases, health insurance, and patient education. So now we're going to start with kind of the first standard precaution, which is hand hygiene. And this is really one of the most fundamental methods to prevent the spread of infections in healthcare settings by eliminating microorganisms on the hands. Adherence to hand hygiene practices not only protects healthcare personnel, but also helps to prevent the spread of infectious agents to patients and others within facilities. In healthcare settings, hands may be cleaned in a couple of ways. The first could be the use of alcohol-based hand rub or sanitizer. So sometimes you'll hear ABHR or ABHS. CDC recommends that products should have at least 60% alcohol in them, but these can range from 60 to 95% alcohol. And they can come in the form of a foam, gel, liquid, or wipe. Other methods of cleaning hands include soap and water, antiseptic hand wash, and surgical hand antisepsis. Some healthcare personnel may need to clean their hands as many as 100 times during a work shift, depending on the number of patients and the types of care that they're providing. It's really important that we keep the skin healthy and clean. And we know that this can be a challenge if we're washing our hands a lot, right? And so it's really important that if we're providing lotions or other products, that they're compatible with the alcohol-based hand rub or soap and water that we're using in our healthcare facility. And so one of my roles at the State Health Department is to go on site to healthcare facilities and provide guidance related to hand hygiene. And this is one of the things that we'll always look for is, are staff bringing lotions and products from home? And maybe could these be counteracting our alcohol-based hand rub? Or is the facility providing a lotion that's compatible with the hand hygiene products that we already have? I wanted to review when to perform hand hygiene. I know many of you are probably already familiar with this, but we always like to reiterate it anytime we're talking about hand hygiene. Hand hygiene should be performed immediately before touching a patient, before performing an aseptic task or handling invasive medical devices, before moving from work on a soiled body site to a clean body site on the same patient. This is one area where when we are performing hand hygiene audits, we do not always see hand hygiene being performed appropriately. Another time would be after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and then immediately after glove removal. It is recommended by CDC that individuals wash with soap and water when hands are visibly soiled. So, to make sure that y'all are still with me, I just added a few questions. It's okay if you don't know the answer, but if you want to go ahead and use chat. The first question is, when should soap and water be used over alcohol-based hand rub? And I am going to depend on you guys using chat so we can answer these questions. Diana, you are spot on. So Diana said, when hands are visibly soiled or during a norovirus or C. difficile outbreak. So good job, Diana. Next question, I just told you this. What percent alcohol should alcohol-based hand rub be? So what's that minimum percentage? If you were going to go look at your alcohol-based hand rub, what minimum percentage would you want to see? Perfect. Good job. I see 60% being put in chat. So wonderful job. That is correct. So one thing you may want to do if you're not familiar with what percent your alcohol-based hand rub is just go look. It'll tell you. I usually see 60% to 72%. You don't want to see 100%, but that 60% is going to be your minimum. If there are products being brought from home, they may not be meeting the 60%. And that's really why, one of the reasons why bringing products from home isn't always recommended in a healthcare setting. All right, my next question is, what areas are most often missed by healthcare providers when using alcohol-based hand rub? Diana's got a few of them. Any other thoughts? Under nails, that's a really good one. That's a really good one, especially individuals that may have longer nails, right? And it's hard to clean. Yeah, so you guys got them. So thumbs, fingertips, and between fingers are the most often missed areas when we're looking at individuals washing their hands. And I do love that you bring up the point about fingernails. A lot of hand hygiene policies do not include anything about fingernails. And so that's something that you're going to want to look at when you're reviewing your hand hygiene policy in your facility, or if you're trying to create one, it might be something you want to consider. All right. And then I always like to throw this reminder in there. During the COVID-19 pandemic, some individuals, because of a lack of availability of gloves, were actually putting hand hygiene products on their gloves to reuse them. And really, That's not recommended. You know, supply chains are back. And so gloves are not a substitute for performing hand hygiene. So we always do recommend that you perform hand hygiene after you take them off. Don't use hand sanitizer on gloves that actually can break down the glove. So it's no longer providing that level of protection. And then, you know, if they are damaged or if you're moving from a contaminated body site to a clean body site, or if they look dirty or have fluids on them, you really should change them. All right. Thank you all for using chat and participating. I appreciate you. All righty. So just a question for the group. Feel free to use chat or feel free to do some self-reflection. But I always love to ask this question when I'm on site at healthcare facilities. And so the question I usually ask is, what is the number one barrier to hand hygiene in your facility? And so this is something I will ask staff when I am doing my infection prevention rounds. And here are some things that I've heard from facilities. So one, product is too slimy. So staff don't like how it feels. And so they aren't going to use it because they don't like how it feels. The sink is too far away. I forget. And Trista, I think this kind of goes to your answer of time, which I completely agree in, is staff are busy, you know, if they have to walk all the way down the hallway to that sink to go perform hand hygiene, that's a barrier, and maybe they don't have time to go do that. Another thing I've heard is there are no paper towels, right? There's no way to dry my hands, and so I'm wiping my hands on my scrubs or, you know, on a surface nearby. The product hurts my hands. So, you know, this was at a healthcare facility that wasn't providing a lotion or type of product that had moisturizing contents to it. And so the staff were talking about how it, you know, was causing cracks and bleeding in their skin. And so they didn't want to use the product because of that. Or all the alcohol-based hand rub pumps are broken. So even if they wanted to go perform hand hygiene, they can't because they're broken. And so, you know, when we're talking about hand hygiene, we want to say, what are the barriers? And really getting feedback from staff is the most important piece to this, because they'll tell you, you know, why they aren't able to perform hand hygiene, or if they like the product or if they don't. You know, I have some facilities that are like, yep, I love the product we're using right now. I wish they'd buy it every time. I have some that are like, I don't like the smell of it. I don't like how it feels. And so having these conversations with frontline staff is so important when we're talking about making hand hygiene easy. All right, moving on from hand hygiene to environmental cleaning and disinfection. So require routine and targeted cleaning of environmental surfaces as indicated by the level of patient contact and degree of soiling. And so some questions that I often like to ask when I'm going through this with a healthcare facility or when I'm on site at a healthcare facility is, you know, where are your high touch surfaces? You know, do you know what your high touch surfaces are? Maybe it's doorknobs, maybe it's light switches, maybe it's the nurse's station, you know, horizontal surfaces. Do you have railings in your healthcare facility? Where are people congregating? Counters, desks? Jonathan, you are spot on. Exactly. Yep. So where are these high touch surfaces at? How often are you cleaning them? There have been times where, you know, maybe we have an IV pull and I'll say, hey, who cleans that IV pole after it's been used? And I'm told, oh, the CNAs do that. So I go find a CNA and the CNA is like, oh, I don't do that. EVS does that. And I go ask EVS and EVS says nursing staff do that, right? And so there's really not always a total understanding of who cleans what or whose responsibility is that. And so one recommendation that we make when we're on site at healthcare facilities is to create a cleaning checklist that says what areas should be cleaned, how often, who should clean them. You know, and during outbreaks, it may turn into everyone needs to clean this surface this frequently because we're in an outbreak, right? And we need to increase the number of times that we're cleaning, and everyone should know how to clean. So Jonathan, it's like you're able to know exactly what I'm going to say next. So exactly, everyone's responsibility, right? Everyone should know how to clean a room or how to clean high touch surfaces, what product to use. And so those are just some things that we've observed when we've been on site at healthcare facilities. The next thing is you want to select an EPA registered disinfectant that's approved for the pathogen of concern, right? So if you're having a norovirus outbreak and you're using a product that's not approved for norovirus, individuals may still continue to be exposed in the environment because we're not using a product that's actually effective against it. And then always follow manufacturer's instructions for proper use of cleaning and disinfecting products. There is an infographic from Project First Line and CDC that I really like that goes through how to read a disinfectant label. Our team uses this when we're doing on-site skills fairs at healthcare facilities to really go through, how do you read a disinfectant label? And a disinfectant label can tell you so much information. It can tell you the active ingredients in the product, the EPA registration number, right? So US laws actually require that all disinfectants be registered with the EPA. We have found some products that were not registered with EPA. And so we would really recommend reviewing what products you're using, simplifying what products you're using. Also included is the directions for use, right? So where could you use this disinfectant? What germs does it kill? What types of surfaces can you use this on? It may say, do not use on electrical devices, right? Don't use on your computer. Don't use on your laptop. And how do I properly use the disinfectant? Contact time. So contact time is the amount of time a surface must remain wet for to be effective against the pathogen or germ of concern. If you have a product that has a really long contact time, that might be a barrier, right? And so the contact time, we typically see adherence when a contact time is about 3 minutes or less. Staff, typically will say, no, I cannot sit and make sure that surface remains wet for 10 minutes. And so that's something we've worked with some of our healthcare facilities with, is just addressing contact time and making sure we're using products that staff are adhering to. There's also things like signal words such as caution or warning or danger. It tells you how risky is this disinfectant and what happens if, it's swallowed or inhaled or absorbed through the skin. There's precautionary statements such as how do I use this safely, as well as do you need to wear certain PPE? There may be products where you need to be wearing gloves when you're using it. First aid. So it does talk about, if accidental splashes or sprays happen, what should you do? And then finally, storage and disposal. So how should it be stored? Some products you may have to mix yourself, and they're only good for 24 hours after mixing. Some products like bleach, you do need to date, label, and mix fresh every 24 hours. So definitely look at what products you're using. And I'm seeing some really good comments in chat right now. Trista says, can't you look all of this up on the Q list? And Trista, you actually will look at different lists are for different types of germs. So for example, the EPA M list will tell you all this information for COVID-19. There's a list for C. difficile. There's a list for norovirus. So there's like an EPA Q list, an EPA K list, and that is a great resource. So thank you for bringing that up. And then Jonathan says, work with EVS and purchasing prior to purchase, run by the safety officer in infection prevention. And I love that you said that comment because infection prevention really should be included in these conversations to make sure we're using products that we need in our facility. So Jonathan, great point. And thank you for mentioning that. All right, our next standard precaution is injection and medication safety. So we want to make sure that when we are preparing medications, we're doing so in a clean medication prep area, that this area is separated from potential sources of contamination, including sinks and or water sources. So we have what we call the 3-foot splash zone around sinks. And this is an area that can become contaminated with, all sorts of stuff that you can find in water. And so if we are, doing med prep right next to a sink, we could be contaminating the medication or any of the equipment that we're using. We want to use a septic technique when preparing and administering medication. So once again, making sure that we're performing hand hygiene, and if we need to wear personal protective equipment, that we're selecting the correct PPE. CDC recommends that you disinfect the access diaphragms of medication vials before inserting a device into that vial, and then use needles and syringes for one patient only. Couple more recommendations from CDC include enter the medication containers with a new needle and a new syringe every time, even if you are obtaining additional doses for the same patient. There have been times when, oh, well, this is going to be on the same patient, we'll just use the same needle. We do not want to do that. There are a lot of things that can happen and negative outcomes that can happen because of that. Ensure single dose or single use vials, ampules, and bags or bottles are used for one patient only, right? So if you're using an IV bag, you wouldn't want to use that same bag for multiple patients. Use fluid infusion or admin sets for one patient only. Dedicate multi-dose vials to a single patient whenever possible. I know a lot of our healthcare facilities that we talk to are actually just moving to single-dose vials instead of the multi-dose vials. And then wear a mask when placing a catheter or injecting material into the epidural or subdural space. And there's a great campaign from the CDC called the One and Only campaign. If you are interested in doing a training on this or sharing education and resources related to it, I would highly recommend checking out the One and Only campaign. And then related to that water exposure and the aseptic technique, as I had mentioned earlier, there have been outbreaks associated with water, such as Legionella or non-tuberculosis mycobacterium. And so, there really is a disease risk to that. And so we always recommend that healthcare facilities review that 3-foot splash zone and just make sure that we're preparing medications in an aseptic manner. The next standard precaution that I'm going to talk about today is risk assessment with appropriate PPE. And when we're selecting PPE, when we may not know the pathogen of concern, we want to look at, are we going to come into contact with exposures to blood, body fluids, and or infectious materials? Could that happen? And if yes, then let's make sure we're using the correct PPE. So we would want to wear gloves when it can be reasonably anticipated that contact with blood or other potentially infectious materials or mucous membranes, non-intact skin, potentially contaminated skin, or even contaminated equipment could occur. We want to wear a gown that, for that task, to protect our skin and prevent soiling of clothing during procedures. We have seen some facilities that are using gowns that aren't approved for use in healthcare settings or aren't going to protect from splashes and sprays, right? And so the clothing underneath actually becomes contaminated. So there's different levels of gowns, and you want to make sure that you're using the level of gown that's appropriate for whatever activity or whatever blood, body fluid, secretion, or excretion that you may come into contact with. And then use protective eyewear and a mask or face shield to protect the mucous membranes of the eyes, nose, and mouth. Once again, when splashes or sprays could happen, right? One thing I like to remind healthcare facilities of is personal eye protection is not considered personal eyeglasses are not considered eye protection. When you're selecting your eye protection, you're going to want to make sure that the tops and the sides of your eyes are protected. And so one thing, that I talk to facilities about is if somebody was beside me or behind me and they sneezed, am I going to have my eyes protected, or maybe are there areas where I could be exposed? And so eye protection, I think, was a big thing that we all learned about during the pandemic. And using the correct eye protection is really important. And the same with face masks, right? Making sure we're using face masks that are approved for what we're using them for. Remove and discard PPE other than respirators upon completing the task before leaving the patient's room or care area. Respirators should be fit tested. You should also be using a respirator that is approved for use in the healthcare setting. There are some that are not approved for the healthcare setting. When we are removing our PPE, make sure we're doing that before we exit the patient's room or the patient care area. There should be a trash receptacle right by the door before exiting. Do not use the same gown or pair of gloves for more than one patient. We do continue to see where someone may be using the same gown patient to patient to patient, and that's really not recommended. Or putting on a contaminated gown, which they could then potentially be exposing themselves that way. And then ensuring that healthcare personnel have access to PPE and trained on accessing, selecting, putting on, removing, and disposing of PPE. So we'll talk a little bit about donning and doffing in some materials for you. But we have seen, where we've talked to some healthcare facilities and we'll say, okay, you have a patient that comes in with these signs and symptoms. What PPE would you grab? Or, we've had staff say, well, I'm going to have to exit the room, walk all the way down the hallway to grab a gown. And so that just doesn't make sense when I'm trying to clean up a patient or a resident. And so really making sure that we're addressing these barriers, we're talking to staff, because everybody wants to protect their residents or their patients to the best of their ability. And so as much as we can take these barriers out, the higher the adherence can be. So here is a slide from CDC on PPE donning. And this is a nice visual reminder for healthcare facilities. We do have some healthcare facilities that actually have laminated these so they can clean and disinfect them, but put them on top of their isolation cards. So there's that visual right there for staff to make sure that they're doing it correctly. Another thing that we like to do with doffing, so here's the doffing, is to once again laminate them, but have a PPE buddy, right? So if you are going into a transmission-based precaution room that is, high consequence illness, we have recommended where you have somebody watch you take off your PPE or watch you put your PPE on and say, oh, hey, I saw that this occurred. Go wash your hands, or, oh, let's get you new gloves. I saw that you had a rip or tear in them. So sometimes a PPE buddy can be helpful, especially if you're training new staff or if you're performing PPE audits and you want to report back out on those. And so with medical equipment, we want to make sure that we are selecting the right product. So as I had mentioned earlier, you want to make sure that any product you're using is approved for medical use if you're using it in the medical setting. There are products out there that are not approved for medical use. What do the instructions for use say? Is the product single use or reusable? And if reusable, how many times? And so there may be gowns, like cloth gowns, that say they're reusable. Well, you may only be able to launder them 42 times. How are you tracking that if that's what the instructions for use say? Some of the N95s did state that you could reuse them up to 9 times. So if you're doing PPE reuse or you're reusing anything, you want to make sure that you're storing it correctly, you're following instructions for use, and just remember, if it's reusable, it could be contaminated. As I had mentioned earlier, if you are using N95s on, it should be listed on CDC's NIOSH approved list. CDC actually just made an update to this NIOSH approved list last week where some respirators were no longer approved. And so we sent the memo out from CDC to our healthcare facilities, just letting them know that, hey, you guys may want to take a look at what brands and models you're using, and see if they're still on the NIOSH approved list or if you maybe need to purchase different ones. Also, as mentioned, N95 should be fit tested for the wearer. And OSHA, that is through OSHA, and OSHA does have a fit testing policy that's really nice to follow. All right, minimizing potential exposures. So one thing that we can do as a healthcare setting is to develop and implement systems for early detection and management of potentially infectious persons at initial points of patient encounter, right? So things that we may implement as a healthcare facility are things like screening questions at registration or check-in, right? So we may ask things like, have you recently traveled outside of the United States in the last 30 days? Have you recently been ill? If yes, what symptoms have you experienced? Have you recently been exposed to someone with a known communicable disease? And so this will help us with triaging and also understanding what's the risk to others. Another recommendation is to use respiratory hygiene and cough etiquette to reduce transmission of respiratory infections. And so you could prompt patients or visitors with symptoms of respiratory infection to contain their respiratory secretions and to perform hand hygiene after contact with respiratory secretions by providing things like tissues, masks, hand hygiene supplies, and signage. And so there's some of those really nice respiratory hygiene stations that some of our healthcare facilities have purchased, and they have found that those are helpful. And then when space permits, We know that this is not always possible. We know that some facilities, you have a very small waiting room. But when possible, separate patients with respiratory symptoms. You may have a triage system where an individual with signs or symptoms that are consistent with the respiratory illness are triaged into a room right away. But these are things, especially during respiratory season, October through March, you could consider putting up signs. We do recommend to our healthcare facilities that you do change your signage up, just so then, nobody gets used to seeing it and then they start missing it, changing the color of the paper, or changing the poster, changing what education you're sharing based on what type of season it is. Reprocessing of reusable medical equipment is the next standard precaution that I'd like to discuss today. And so CDC recommends that facilities clean and reprocess reusable medical equipment prior to use on another patient or when soiled, and that it is recommended that facilities refer to manufacturer's instructions for reprocessing. And then another recommendation is to maintain separation between clean and soiled equipment to prevent cross-contamination. And so one thing that we look at when we're on site at healthcare facilities is, how is equipment being stored? And one question that I always like to ask is, hey, how do I know that that piece of equipment is clean, ready for use? And a lot of times I'll get, well, we just kind of assume that it's clean, right? And so we say, take the assumption out of it. Get a system in place that really helps you to either have a dedicated space for storing clean equipment. You could have a room that's labeled as clean storage only. And so, if it's in that room, it is clean. Some of our facilities use clean or dirty tags. It's a red or green tag. Some use magnets that say clean or dirty. But having a process of how to know that these are clean, ready for use, and then storing in a way that helps to prevent contamination, right? If we're storing clean equipment with dirty equipment, then that clean equipment's really no longer clean. So question for the group, can you name some examples of reusable equipment that you use in your facility? Things that you may use on multiple patients. And I put a little list together of things that I typically will see. Vitals cards, that is a great example of reusable equipment. I often like to ask, how is that cleaned and disinfected between residents? And so things like blood glucose monitors, blood pressure cuffs, oximeter probes, surgical equipment, endoscopes, wheelchairs. Wheelchairs is something that we often see in our healthcare facilities, that there's not always a great process or swings and things like that of cleaning between patients or residents. And so helping facilities come up with a process that works for them. Once you come up with a process, we do recommend that you perform audits on that process. Is it working? Is it not working? Does staff adhere to it? Does staff like it? A lot of times we hear really positive things when our healthcare facilities do implement this, that staff like having a process and knowing, when a piece of equipment is clean or dirty, and things like that. So some key points from today's session include CDC's core infection prevention and control practices are fundamental standards of care that should be implemented by all healthcare personnel in all healthcare settings. These practices represent minimum expectations for ensuring patient safety and should be supplemented with additional infection prevention and control measures based on the specific setting, patient population, and type of procedures or patient care interactions being performed to prevent infection transmission. Adherence to these recommended IPC practices is essential to prevent the transmission of infectious agents. And so one thing that we've shared with our infection preventionists and our healthcare facilities here in Montana is, stop, think IP, right? Where could transmission occur when I'm doing this patient care activity? If I'm providing wound care, if I'm assessing a patient who has respiratory symptoms, where could transmission occur? And then how can I break that chain of transmission, right? When should I be performing hand hygiene? Should I wear personal protective equipment? Should I clean this piece of equipment before I use it on another patient or a resident? How am I going to clean it? Am I using a product approved for the organism or germ of concern? And then, if I don't break the chain of transmission, what could happen? What could happen to my peers? What could happen to my patients? And so I think this always kind of just helps to assess the situation and figure out what steps can I take responsibility for to really help prevent transmission of disease. My final slide today is about the resources that we provide here in Montana. So our section, we are considered the non-regulatory agency here in Montana. And really our role is to provide guidance and education and resources that relate to infection control. We get the opportunity to support our healthcare facilities during outbreaks of communicable diseases. We provide infection control guidance specific to that outbreak that they're experiencing. And so, for example, if they're experiencing an outbreak of MRSA or COVID-19 or influenza or norovirus, we're able to take, an hour or a couple of hours and really just talk with this facility through, what infection control steps are you taking? Oh, what product are you guys using? What personal protective equipment do you have on hand? Do you guys need support as it relates to getting more personal protective equipment or testing? And so really just getting to work with our healthcare facilities and supporting them when they're going through something that's really tough. Provide on-site infection control assessments. These are things that I referred to throughout the presentation today. It's one of my absolute favorite parts of my job is getting to do on-site infection control assessments where we're really just looking at, what do you have right now as part of your infection control program? Maybe where are there some gaps? How can we help identify and target those gaps? And how can we provide resources for you? And this has really created just such great relationships between our health department and healthcare facilities, and just being able to support these healthcare facilities to improve their infection prevention programs. We provide training and educational webinars to our healthcare facilities. And then all of these services that I have mentioned are free to all Montana healthcare facilities. And we just absolutely love getting to work with our healthcare facilities. And so just as a note, this is what Montana provides. I just wanted to provide some examples of what your state health department or local health department may be able to offer to you. And so please reach out to your HAI program to learn more. I will tell you what, they will love to hear from you. I know I love when a new facility reaches out to me here in Montana. And we just really love getting to work and support our healthcare facilities. So that is my presentation today. Here is my contact information. It did look like we had a question in chat. I didn't want to ignore you, Sarah. But I just thought I'd get through that, and then I can answer your question, Sarah, regarding double gloving. And so example, I like to have one pair that goes under the sleeves of my gown and then another set that goes over the sleeves of my gown. And I will tell you what, Sarah, double gloving has been a topic of discussion in a lot of our healthcare facilities. So one thing I would say is it does depend on the type of activity that you are doing. There are some surgical procedures where double gloving is recommended. In most clinical situations, CDC states that double gloving is not recommended. There are a couple of infection control concerns related to that. But I always tell facilities, refer to what your gloving policy is, refer to your hand hygiene policy. But overall, for most clinical situations, CDC does not recommend the use of double gloving. All right. Any other questions or comments or things that I can answer today while I'm on the call? And I'll put my camera back on and probably stop sharing slides just so then I have enough internet bandwidth. Any questions? I hope you all learned something or can take something away from the presentation today. I know our facilities have taught us so much. So also, if you have something you want to share with me, I would love to hear from you. Any challenges or things that you guys are facing? And Julianne asked if we can make the presentation available. Adriana, I think you definitely can share however you guys typically share. Yeah, Jonathan, do you want to give me a little bit more information kind of related to your question of environments of care, what to look for and how it's a best practice? I don't know if you can come off mute and kind of maybe explain a little further. Are you kind of saying like, oh, perfect, I think I hear you.
Yes, ma'am. Good afternoon, Ms. Baldry and colleagues. Asking about, I'm the safety officer here at my facilities, and like everything else, everybody's busy. It's a challenge trying to get the environment of care roundings. It's a big team, facilities, EVS, myself, infection control, other people. So going, say, emergency department or maybe MTUs, looking at your tools, the tools that they have, machines, also tools that were disinfected, meaning that they were, the best way I can describe it is like, I'm thinking Clavamox. I used to work in a vet clinic, so I know they
Okay.
did that stuff. So how they taped it up, how it was clean, and what to look for, because what I came across was in some of the ED room, they did some of that, but looking at some of the tools, they were rusted out. Why do we have rusted out material here? So if we were to get a surprise visit by the Joint Commission, we'll probably get
Yeah.
flagged. So I guess what to look for, because yeah, I'm safety, but what I could look for as far as cross-referencing with infection control,
Yeah.
because right now we have infection control slash employee health. So a lot of onboarding goes on, and people are preoccupied. So maybe I could
Yeah.
step in and look for some items that I need to point out. Yep.
I think this is probably one of my favorite questions I've ever got on a presentation. That is such, I love that you've asked that of like, how do I put my infection prevention glasses on, right? Even if I'm not
Yes.
the infection preventionist.
Yes.
And that's something I actually didn't say in the presentation today of like, infection control is everyone's
Yes.
responsibility and infection control is a culture, right? It's not a
Yep.
person, it's really a
Yep.
program and a culture. So I love that you brought that question up today. And, I think what I would say there, our team actually, we developed a little tool for us for
Mm-hmm.
this exact reason, right? Is we call them the 4 pillars of infection control. And so we actually have a document where we have these columns, right? And so we have one for hand hygiene, one for personal protective equipment, one for cleaning and disinfection, one for transmission based precautions, and it's sitting on top of standard precautions and aseptic technique, right? So it's very
Mm-hmm.
visual. And this is kind of the checklist that I go through, or I have, anyone at a healthcare facility go through. And so your observation of why do we have rusted medical equipment in this area is perfect, right? You're
Yeah.
not an infection prevention expert, but you can say, hey, this is a concern because this can't be cleaned and disinfected. There's rust on here. If we use this on
Mm-hmm.
a patient, we could have disease transmission occur, or we could have poor outcomes occur. And so those I think are the things that I would look at is observe staff. Are they performing hand hygiene? If you're seeing no one perform hand hygiene, there's probably a gap in hand hygiene.
Mm-hmm.
If staff are doing a pretty good job performing hand hygiene, you're like, okay, I'm feeling pretty good about this process. Um, the same thing with PPE. If you see someone wearing PPE in the hallway moving from patient room to patient room, that's probably a red flag, right? You're probably like,
Oh, yes.
why are they wearing that same gown room to room? And I think anyone could observe that, right? So a lot of
Mm-hmm.
facilities are like, we should not see PPE in the hall. We should not see staff wearing PPE in the hallway unless we're in an outbreak and this is a COVID unit or something like that, right?
Mm-hmm.
And so I think I absolutely love that you asked that question. We try to bring it back to the basics of infection control, which really is standard precautions, right?
Mm-hmm.
Are staff wearing PPE appropriately? Are they washing their hands? I tell my staff all the time, we're not experts on everything, right? That's why we have pharmacists. That's why we have physicians. But as much as we can integrate infection control into everyday practice and making it everyone's responsibility, the better that our infection control practices and adherence will be in our facility. So I hope that answers your question. I absolutely love that you asked it. Does
Well,
that
if
help?
you could share with me your little poster that your pillars, that
Yeah.
would be nice, to even have up here, even around my desk, I'll glance at it every day. I walk by that front entrance and I'll think, okay, that's what it is. That's where I'm at. I'm back in this arena, so to speak. My responsibility, as it is everybody's responsibility, because some of the things that I have difficulty even working with some of my colleagues is the facility staff. You
Mhm.
know, whether they go around looking at your fire alarm checks or your smoke detectors, fire sprinklers, all this other good stuff that people don't really talk about, but how that involves some of the work they need to do, like access into your ceilings or going into mechanical rooms, maybe next door to the ED. You know, just over the weekend, we had a break upstairs.
Mhm.
The tile in the shower started to leak and it came through the ceiling in the emergency department. So of course we had to instill ICRA, PICRA, and all that other good stuff, but educating the facility staff, you know,
Yep.
men that are brawn, work their hands inside, outside. But when it comes into your healthcare facility, when you're working with patients, it's a different story. Having them understand that, you know, certain precautions we have to think about. You know, this is why we have to put up a wall. This is the tape we have to do. We have to put zippers on here. We have to
Yep.
keep everything. It's a whole mitigation process, but trying to teach them that, you know, it's a different when you're a nurse or you're infection control, but you know, having that to meet and I guess talk it over and understand one another, you know,
Mhm.
because I have problems with that. And I just kind of feel like, geez, in this case, it's like I'm the person that married these two entities here, you know.
Yep.
I'm the preacher here, or the, you know, so I kind of get into that situation, but something like that would be nice.
Yeah, and I think that's where that stop think IP can come into play too. Is almost everything at a healthcare facility that's done throughout the day is related to infection prevention, right? So a lot of people are like, construction, why does the infection preventionist need to be involved when I'm replacing a ceiling tile, right? And then you start educating them on, well, because there could be fungus or, all
Yes.
these other things that could happen.
Yep.
And so I think that stop think IP and getting people into that that becoming second nature of
Mm.
how should infection prevention be implemented in whatever I'm doing. It's really fascinating to also see that change happen in staff because it starts clicking. And once you explain the why, I think behind a lot of, I think infection prevention, sometimes we're just like, wash your hands, right? You just need to wash your
Mhm.
hands instead of explaining why it's important and really connecting the dots of like, this is why it's so important you perform hand hygiene and using things like Glow Germ. That I think really makes an impact on our staff because once again, staff are there because they care, they want to do the right thing, they don't want to give their patient an infection, they don't want to spread infection to their peers. And so a lot of it is just educating and connecting those dots and just making a passion for infection prevention. As an infection preventionist, I can talk about it all day every day and I absolutely love it. But I can definitely talk to some of my healthcare friends and they're like, Erica, like, can you stop talking about hand hygiene for 20 minutes, and it's like, but this is
Mhm.
why I care. And yeah, so I think just stop, think IP. How can you implement IP with whatever you're doing?
Definitely. Yes, ma'am. Awesome. Well, yeah, it's changing the culture. That's what it is. Changing the culture. Yeah. But thank you. Great presentation. Yes.
And I do have some of my staff on the call today, so they're putting things in chat too. We're really lucky here in Montana to have a really nice team of IPs that absolutely love what they do every day. And Adriana, I can send you that 4 pillars document we have if you want to send it to Jonathan.
Yes, ma'am, will do.
Thank you.
So do we have any additional comments or questions? All right. So it is now 2 minutes to the hour. So I want to take this time again, as we all know, tradition. Let's use those reactions to show Erica our appreciation, the chat box to show our appreciation. And as we give her some of those reactions and love and claps and whatnot. I just want to remind everyone that we are having our Tribal Infection Control Institute doing the National Tribal Health Conference on Monday, May 20th, doing the National Tribal Health Conference. Later this week, we will be releasing the scholarship information to help support some travel for our tribal healthcare workers. So be on the lookout for that. But again, the Tribal Infection Control Institute will be Monday, May 20th, doing the National Tribal Health Conference in Rapid City, South Dakota. Our next webinar will be Wednesday, April 24th. Starting in April, we will be able to offer CEUs for the rest of our webinars. So just to help get some of those contact hours that you all may love and need. So Dree did do her job to make sure that we can start back offering those. So starting April 24th, we will be offering CEUs. So be on the lookout for those. So if all hearts and minds are clear, Dree's gonna let you all go. It's 5 on the hour. We ended on time. So everyone drink some water, smile at somebody, do something kind, be kind, and know that you all are doing amazing work in each of your facilities, your clinics, your health departments. Dree is very grateful for you all. This is also your week, is patient safety awareness. Patient safety is an all hands on deck. Every single person in your facility is important, and making sure that we protect not just the patients, but also the staff, because we need you. We love you. We want you to stay there. And so take care, and y'all have an awesome evening. But don't forget, do the evaluation. Thank you. Bye-bye.
Thank you.